Hi guys, this is Dr. Jof and I'm here at the Cebu Orthopedic Institute. What is the number 2 objection that I hear patients comment? Dok, wala kaming pera. Dok, may problema kami sa financial, wala po kaming budget. Dok, di kaya. It is money. So, pag walang pera, hindi kayang gawin kahit ano. Walang pera pang consultation, walang pera pang opera, walang pera para sa implant or stainless para sa surgery. Dok, wala. So, ano po yung pwede natin gawin sa mga patients? Paano natin sila matutulungan? How can we help these patients so that they can still have a quality of life? So, number 1, meron pong mga government institutions. They can actually help get our patients a consultation. Just need to go through the website po sa mga government hospital. Pwede po kayong magpakonsulta even if you're in Visayas, Luzon, Mindanao. You can get an online consultation from multiple hospitals, government hospitals around the country po. Here in Cebu, Vicente Soto, sa Quezon City po, pwede mag-online consultation po sa Philippine Orthopedic Center at iba pa. Pera, no budget for the implant or the stainless. For this, you can actually go to number 1, the DsWD, Department of Social Welfare Services, and yung kailangan lang i-present ng doktor sa inyo is yung medical certificate at saka yung prescription ng implant. Of course, kailangan din yung diagnosis at saka what procedure the doctor is about to do on you. Then you can have waiting period of some few weeks at saka it can actually improve the chances of you getting that surgery kasi mababawasan po yung presyo. Ibig sabihin, the DsWD will partially or even sometimes mga 50% ng stainless po yung mababayaran ng DsWD. Maraming salamat sa mga kapatid natin dun sa DsWD. Thank you so much for helping our patients po. There is also the Philippine Charity Sweepstakes Office, yung PCSO. They can actually help you get your implants or sometimes even part of the medicines for hospitalization. Sa mga provinces, they usually give an amount of about somewhere close to 50,000 pesos. If you pass all the requirements, again, if it's an implant, kailangan ng doktor magbigay ng medical certificate stating the diagnosis at saka what you are going to go through the procedure and also the prescription ng stainless or implant for the procedure po. So again, maraming salamat. Thank you so much to the Philippine Charity Sweepstakes Office po. You're helping a lot of people ever since residente po ako sa Manaway, Quezon City. Just like yung mga private hospitals, meron ding counterpart na government hospitals for surgeries, for consultations. And there are also private institutions and foundations na nakakatulong sa mga less fortunate or indigent patients who need surgery. There are many foundations out there that serve part yan ng tinatawag nilang CSR. So it's like a corporate service and responsibility, and they want to give back. So there are government offices that are very willing to help yung mga less fortunate patients na nasa hospital na kailangan ng mga procedures. Dito po sa Cebu City, if you're a voter in Cebu City, merong tinatawag na CHAMP. If you're in the provinces, some of them actually have a budget. Pwede po kayong magpatulong. You can ask help from the barangay officials. They know that there are certain budgets. Lalo na pag may patient na kailangan ng tulong, pwedeng lumapit sa kanila po. Walang pera para sa ospital, para sa mga doktor. Again po, meron mga hospitals that do charity services, and for those who are indigent, you can go to certain hospitals, government hospitals that can give everything free. Meron ding po mga private hospitals who can give you charity admissions. Again, yung big difference ng government at saka private is still big. Sa private, walang bayad nga yung doctor. You don't pay your doctors, you don't pay the anesthesia, the surgeons, and the internists. The laboratory, in the hospitals na private, they can be discounted. Hindi talaga free. But in certain hospitals, they can give you an admission day of at least mga 5 days libre. So, you will still be paying for yung mga stainless sa mga private hospitals. Pero sa government hospitals po natin, may chance po na ma-charity, malibre po lahat. If you have other questions, come visit me at Cebu Orthopedic Institute and I will try my best to help you. So, I hope this helps po, especially if you are considering a procedure. Ask your doctor kung ano yung mga ibang options. Personally, I will try to help my patients if they really truly need the procedure. I help them get through the process, getting them PhilHealth kung wala silang PhilHealth, going through their local government agencies or LGUs na makakatulong, going through foundations and finding sponsors. If I can't do the procedure, pwede naman i-refer sa mga government hospitals which I used to work in. And again, I hope this was helpful sa inyong mga lahat. Thank you so much. Have a great day. Remember, this is Dr. Jof here in Cebu Orthopedic Institute. Much love and respect to those listeners. Have a great weekend. Bye-bye. Walang pera para sa ospital, para sa mga doktor. Again po, meron mga hospitals that do charity services, and for those who are indigent, you can go to certain hospitals, government hospitals that can give everything free. Meron din po mga private hospitals who can give you charity admissions. Again, yung big difference ng government at saka private is still big. Sa private, walang bayad nga yung doctor. You don't pay your doctors, you don't pay the anesthesia, the surgeons, and the internists. The laboratory in the hospitals na private, they can be discounted. Hindi talaga free. But in certain hospitals, they can give you an admission day of at least mga 5 days libre. So, you will still be paying for yung mga stainless sa mga private hospitals. Pero sa government hospitals po natin, may chance po na ma-charity, malibre po lahat. That's all the time I have for today. I hope you guys have a wonderful, wonderful weekend. Salamat sa inyong lahat for listening and thank you for empowering me to make these videos. I hope to see you soon.